那他这个问题很好的。
The reason why more and more patients come here for the cancer treatment because the first one is a treatment. Our treatment here is a comprehensive treatment, intested comprehensive treatment. Not only using the single way to fight against the cancer, that we also need to base on the patient's physical situation and also the tumor type, and also together with the patient's mind, that we will mention very complete the best treatment options planned for the patient. The second thing is that the treatment in Guangzhou more economic than the treatment in Europe or in USA. The third one is that we also will respect the patient's feelings. Like maybe some patient doesn't want to do the surgery because they will think that the surgery will bring a lot of side effect on the body. So we also will respect the patients. If they don't want to do the surgery, then we could have the plan A, plan B, and plan C for the patient. That's why the patient prefer our hospital here.
对于这个问题啊，是我们经常在医院。
For the cancer patients, as a doctor, that we need to know what is the staging for this patient. Is it an early stage, middle stage, or advanced stage? Is there any metastasis in the other part of the body? And together that we also need to know the tumor size in the beginning. This is the first step. So for the second step, we need to know the result. Is it a benign or is it malignant? But in case that this patient belongs to the malignant tumor, so what kind of the cancer it is? This is also very important thing for the doctor. And the third part, the doctor needs to qualify the very accurate diagnosis. So based on this information, then the doctor could have an initial idea in their mind that what kind of the treatment is the best for this patient.
的确啊，因为我们的
Is there any training for the patient care because they're coming from different countries? They have different culture, language, and also the behavior. Yes, of course we do. Because you know that different countries have different belief and also the religions is also different. So what we need to do is make them comfort, no matter in mind and also physically. For example, one patient that she doesn't want to do the surgery, she strongly refused to do the surgery. But according to the doctor, maybe the surgery will be the best option for the patient. So we will let the patient know that before we start the treatment, that we will have an MDT discussion. MDT is a multiple disciplinary team. Different directors from different departments will sit in together just like what we do here. That we will talk about the case, the patient's case, what kind of the tumor it is and what the tumor situation, is there any metastasis, how bad of the patients right now. Based on this information that we could provide the best options to the patient. As the patient doesn't want to do the surgery, that we could also have the plan B. Even the plan B that without the surgery, but the effect is also equal to the surgery effect.